Director just around the corner here of Optimal Health. He trained in Cape Town and Britain and America, and he's going to give us his very personal view now about how sex therapy has changed in his lifetime from the 80s to the present. Thank you, Mike.
Hi. It is a personal view. I'm very aware that my own trajectory through sex therapy over the last very long period, it was in fact from the end of the 70s, is my own particular voyage. And I'm going to miss out the names of all sorts of famous people who may well not be here tonight, but you may view them as very important, and I haven't had much to do with them. I wanted to say something in relation to what Jane was saying, because I was sitting there cogitating about having to talk myself, and at the end of talking I'm going to say something about my observations which come from having been a sex therapist. But I think the nub of it is that I've come increasingly over time to address myself to the individual when I see them, so that I often don't have a particular expectation about how they are going to find some sort of resolution to whatever they've come about. I thought there's lumpers and splitters, you know, that old idea that we will find diagnostic categories, fit someone to it, and then we'll have a plan of management. Speaking from a medical background, that's been the tradition of that discipline. And I thought, what's the label for what I'm thinking of doing with people? I'm still not quite sure, and you may correct me, but I think it may be existentialist. That one takes an individual in the particular moment of their experience and you ask them to find what is right for them. There is a lot involved in doing that. There is, to start with, permission. And I'm well aware that working in the health service, working privately, sitting looking like I know what I'm talking about, on the whole, one comes with an authority. And I think that also is important. It's the permission. One has to somehow equal the disempowerment that people have had earlier in their life from parents who said, you can't do this, you shouldn't do that, whatever. So people need permission to actually find out and start to think, what is right for me? What is right for me in this relationship? And is it the same now as it was before? And enough. I have a few observations, but they come at the end of what I'm going to say. And I thought, what is sex? I'm not going to talk to each of them. I'm not going to actually read out these, because I'm going to leave you to do that. It leaves me free to talk about things that I'm reminded of as you read it. Nearly everyone has a view about sex. Well, yes, that's certainly true. Given the right situation, my experience is that people actually like to talk about sex, whether they're younger or older. And I think the interest in talking about sex, in my experience from 4-year-olds, is that they get interested about that age in talking about sex. If I talk about really older men, I think they have an image of themselves as being a sexual person. Whether they actually are sexual, whether they do things sexually or not, is another matter, but it's built into them in their psyche in a way, it seems to me quite often, that isn't in the same way in women. That's a generalization, but there you go. So we do have a definition. I remember, what do we call ourselves doing this work? And there really were, in the late 70s and 80s, these different labels put above the door of the clinic. I missed one off there, actually, and that's sexologist, which I'll come to in a minute. And I meant to ask, how many of you would identify yourselves as sex therapists? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. About 12 of us. That's good to know, because maybe it will affect what I say. Right. Maybe understood in behavioral, medical, and intrapsychic terms. Yes, well, behavioral is what we do. medical, I think, is, I want to say more about what being a doctor does when it comes to practicing. It means we examine people. That makes a difference. It means we prescribe. That makes another difference. Intrapsychic, well, that implies the psychological or psychotherapeutic background. To me, that means we listen. And sometimes I wonder, working as I do with a bunch of urologists, whether they're not the experts on doing and I'm left doing the listening afterwards. And there's some sort of a balance that is very important about the listening and the doing. We will all have been party to surveys of one sort or another. I picked out, not entirely at random, but 3 surveys which were approximately 25 years apart, because I wanted to draw your attention to the context in which sex therapy was developing at that time. We're talking about the very late 40s and the 50s. I didn't know Kinsey. I mean, I might have done, but I never met him. But I did meet one of his team, and I had the sense, and this is one of the key words I want to use. We are pioneers in sex therapy, and if ever there was a pioneer, it was Kinsey. I think he was probably something of a maverick as well, more of which later. A very exceptional man. He was criticized, but there was something so novel about the work he was doing that John Bancroft, who became at Indianapolis in charge of that department where Kinsey was. I know Kinsey's got a whole lot of archives still in the basement of the university there that are relatively untouched. Some of the material that he gathered was hot. You know, he found out an awful lot about people. What he made of it and what he could write about, I think, has never really been completed. And my experience of John Bancroft is he's doesn't talk about it much, but I think there's some fascinating work still to do by going back to the original material he had and having another look at it. Becker was in San Francisco. I trained in the Institute for the Advanced Study of Human Sexuality. No modesty there in that title, but it was in San Francisco, and it was in the late 70s. And it was in that period of time which lay between contraception coming along on the one hand for women and HIV coming along to the detriment of us all, not more than 10 to 15 years later or something like that, wasn't it? But I was there in the gap between, and there was a very strong sense of permission. One of the things I want to convey is the excitement. This is entitled as a series that relate to sexual pleasure, and I thought, funny, what can I say that's about pleasure, that's to do with the work I do? And I think if I look back, it lies there in the enthusiasms of the people who were there. Ted McElvenna, anybody know Ted McElvenna's name? The charismatic guy who was of the church and evangelical to boot. And he went beyond the bounds of what we would often call decency, but he did it in the interests of the patients he worked with. And he gathered around him a selection of people who came from every sexual interest. And I went down there for a fortnight, one summer late in the 70s. And it wasn't perhaps entirely a conversion experience, but it was very much an eye-opening experience. I saw the gay parade. I met people who were surrogates. I met people who were transsexuals in the process of transition. I met people who were into sadomasochism, and we had someone who came along with their box of whips and showed us how they used them and things like that. It was an extraordinarily enlightening experience. And I think it led on to much else. I hope you're reading the PowerPoints as well as listening to me. I'm making some points, and these are from slides that I've used many times over. The NatSal survey. I do want to mention a friend of mine, Kay Wellings, Professor Kay Wellings, who I invited to come here tonight, but she was not able to do so. And she has been part of a team, powerful academic team, looking for evidence-based stuff about our attitudes and behaviours. The earlier part of the surveys were supported because of the interest in HIV, and Maggie Thatcher herself